Just last year, the folks at Gallup commissioned another poll and found that the tide had changed on those ideas. In fact, more than 68% of Americans actually favor decriminalizing homosexuality and don't seem to have a problem with it. Today, we're going to be talking about another issue in the community, specifically HIV and the LGBTQ community. So first slide that I have coming up here is going to talk about the estimated new diagnoses as of the year 2014 when this was commissioned. So you can see this large number in red represents Black MSM, which is code men who have sex with men. That's the acronym. And you can see that by some 11,000 new cases diagnosed in 2014, they're far outpacing other groups such as white men who have sex with men, and down at the opposite end of the spectrum, white women who are having heterosexual contact. So those happen to be the lowest numbers, tuning in at about 1,000 individual diagnoses in the year 2014 compared to more than 11,000 in that same year, with white men and Latinos and Black women and heterosexual men falling along the scale. So if we take a little deeper dive into that number here on our next slide, HIV in 2016. Now there are approximately 4.5 million gay and bisexual self-identified folks in the US. 15% of those are living with HIV infection. So if we go in deeper on another number here, new diagnosis in 2014, referring back to that year, 92% of those new diagnoses were in the gay and bisexual men who are ages 13 to 24. We're talking about a very young population here, looking at that 92% number. And nearly 1 in 7, which is a startling number, of those bisexual men are living and unaware that they are infected with HIV. So those twin things that can cure, treatment and prevention. We're going to get into that more with our experts in the A Block.
Pride Month is here, and amidst the parades and celebrations of sexual identity, one of life's true rules still applies. If you've got your health, you've got just about everything. So how good is the overall health of the LGBTQ community today? And how can we work to improve it even further?
Well, to tell us about many aspects of the LGBTQ health as we can get now, we want to welcome back two guests to BK Live. First, our longtime friend, Dr. Monica Sweeney. She serves as the clinical professor and chair of the Department of Health Policy and Management and the vice dean for global engagement at SUNY Downstate Medical Center. Great to have you back at the table,
It's
Doctor.
great to be here.
We're also happy to welcome Dr. Jeffery Birnbaum back. He's the executive director of HEAT, Health and Education Alternatives for Teens. Thanks for joining us again, Dr. B.
Thank you.
You know, I just want to start the conversation off in addressing that clip that we just saw. You said that was a young Gore Vidal?
Yeah.
That's
Yeah?
a good one.
Yeah.
How far have we come as societies since 1967 and our attitudes toward this community?
It depends on where the people that you're talking to. There's a reason that there is a disproportionate number of LGBTQ people in New York City, this coast and the West Coast. It's because there are communities that tolerate, embrace, accept the LGBT community to a large extent. And so if you just look at get the statistics as a whole, it looks like we've come very, 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 very far. Mm-hmm. But if you look at specific places in the country, they haven't moved nearly as much as they should. And even in places like New York City, there are people who will give you lip service to it, but they're not really there.
So, Dr. Birnbaum, how do these sort of social mores affect health outcomes?
Well, I think also in those statistics that you show, the disproportionate burden that Black men are having, and that shocking statistics of 92% of the new cases were all in young men ages 13, 24, I would say that disproportionate burden still holds, maybe even more so among young men in terms of ethnic imbalance in who's getting infected. I think that it's probably easier for a young white kid to come out to his family than it is for a young black kid. It's probably pretty painful to go to church on Sunday morning and hear you're an abomination on Sunday morning. And this is something that I think drives a lot of the young people that I serve into higher risk behavior. It's something that they can't be open with their families about and seek support about. So, you know, to varying degrees, certain things are better, but there are areas where which it's just not much easier today for certain sectors.
Yeah.
Well, for those sectors that we're talking about, what would you say are the biggest sort of medical needs within the LGBTQ community?
You know, I'm sorry that we have to have clinics and doctors who deal specifically with the community, because when you train in medical school, you should be trained to take care of almost anybody who comes to you. But we do have heat, thank goodness. And in addition, there is another clinic at SUNY Downstate where they have an LGBT. My granddaughter told me you're supposed to see LGBTQ plus.
Okay.
Okay.
The entire spectrum.
LGBTQ.
Everybody in.
Plus, yeah, so there are specific needs that that people have. And the last data that I have, and I don't remember if it was 2014 or 2015, that says 20% of LGBTQ persons who go to their clinicians don't disclose that they are LGBTQ. And so that is 20%. That's 1 out of every 5 go to their doctor to get care, and they don't disclose that they are LGBTQ. That's not the case when you have a special clinic,
Right.
hence the need for them. So in addition to the physical problems that people have and the emotional problems that people have, and after you go on a while, I will get into a little bit of the emotional issues.
Yeah.
They still have health issues that need to be addressed that are not addressed when you go to your local PCP.
So health and education alternatives for teens, speaking right to that population. You're on the front lines working with the people who we see are most at risk, those people who are 13, 14 to 24. So what needs are being presented in your clinical setting? What are you seeing?
I think probably the biggest aspect of that can get in the middle of the medical care and muck everything up is social issues. And not being able to come out to your family, not seeking social support that you would get from your loved ones. Make it worse, being put down when you have come out, being told there's something seriously wrong with you.
Put out of your house.
Or being beaten, thrown out of your house, having to engage in sex work. We see young people who come to us who have just had trauma upon trauma upon trauma inflicted upon them. And it's really difficult to engage some of the health issues when they've had all these traumas just layered on top of each other. And so what we try to do is engage them in a safe space, welcoming, engaging, acknowledging them as human beings first and foremost. And then we can get into some of the real health issues. We have young people who, I was looking at some of my lab results from last week. I was just shocked at how many of the young people I served had positive syphilis tests. And sometimes this is in somebody who's on PrEP.
Right.
There's one thing we know about with HIV and syphilis, they like to travel together. So luckily some of these young people are already on PrEP, but just to see syphilis continuing to reinfect people is just really disturbing.
Can you clarify what is PrEP and distinguish that from PEP?
Okay, so PrEP is a pill, 2 drugs, combination pill, tenofovir and emtricitabine. They come under a commercial name of Truvada. And if a person takes a pill once a day, they can largely eliminate the risk of acquiring HIV, even in instances when they're not using condoms. The syphilis example I'm giving tells you why the condoms are still important, and it's not just syphilis, gonorrhea, chlamydia, all kinds of other sexually transmitted diseases that continue to go on. So, but if a person takes PrEP daily, and a lot of the statistics around adherence to the medication says at least if they take it 4 times a week, because a lot of young people will not remember to take the pill every day. If they take it at least 4 times a week, they stand a good chance of not catching HIV at all.
So, Dr. Sweeney, we know that there's a treatment piece and there's a prevention piece, but there's also just getting tested, period. So where does PrEP fit in on that spectrum?
PrEP is one of the prevention tools. Having said that, I do hope that young people who've tried every other means of practicing safer sex will try the other means and not think that PrEP is the first thing you should go to.
Yeah.
Because it's a medication, and as most medications, including aspirin and Tylenol and so forth, have side effects. And I've had 2 friends, 2 is not a huge study, but they have done huge studies, that have had people on PrEP, and they had to come off, my 2 friends, because it caused thinning of the bones. And when you get all these young men starting PrEP, and at a young age, you're going to see the consequences later on. But it's
So
still...
does this give this target group a sort of false sense of security with this drug? Or?
They could prevent HIV. And HIV, as we say, is no longer a death sentence,
right.
but it's a life sentence. You have to take your medicine all the time. 4 times a week is okay for PrEP, but it's not okay if you're infected. So it's part of the prevention package. PrEP is a good one.
And it's also a trade-off. You know, what's worse?
Yeah, that's right.
Thinning of the bones at a certain age where it might be more likely to happen, or getting HIV and having to take other medications which will have that much more side effect to deal with.
The other thing is that every single person should know their status. And if you take it once and you don't engage in risk behaviors, and you're positive that your partner is only your partner, hard thing to be positive about, then you don't need to take it anymore. I don't need to take one anymore. But most people need to take an HIV test frequently, because they say, I'm monogamous, but they're not accounting for the other person. So getting tested is a part of something that everybody should do. But the problem in our community, the black and brown community, is people think testing protects you. And testing doesn't protect you. It may protect the next person so you don't give it to them if you have it. But the act of getting the test is not protection for you getting HIV.
Well, as we're sitting here right now, you can still go to a New York City Health Department clinic and get these tests, and a lot of partner organizations for free, and even start to engage in PrEP. But we know there's a big fight over health care in this country. So is there a specter about a loss of funding for clinics like yours or the organization that we should be aware or active about?
Or specifically, just people with pre-existing conditions, how does sort of Trump Care affect their costs
All
and
that.
access?
Yeah.
I worry more about what will happen at the federal level. A program like mine, where not every service that we provide is reimbursable by insurance. And with young people, getting access to their health insurance information is a challenge in and of itself. So we rely on outside external funding from state and federal government. I worry a lot about the future of the Ryan White Care Act, which funds, I don't know the exact dollar amount, but every year it's well over $1 billion in the federal budget that's distributed across the United States. And a lot of my services are funded through the Ryan White Care Act, both directly from the federal government as well as money that gets sent to New York State and is combined with more local resources. So it could have an impact depending on what happens with the Ryan White Care Act. Independent of this Trump Care issue, who knows what's going to happen with that?
And of course, if you have HIV already and that plan goes through, then you could never change insurance from where you have your insurance because pre-existing conditions. People stayed at jobs in the past that they wanted to leave, go up the career ladder, do this, do that. But the list of pre-existing conditions, you wouldn't believe some of the things that are on it. So it's not just HIV and diabetes and cancer. It's a list that is as long as your arm. So that would just be a horrible thing to happen to the people in the United States. And the Affordable Care Act has caused the uninsured rate to drop from 26% with African Americans to 11%, from Hispanics from the 30s down to the high teens, 17%. The number of people insured in the United States has never been higher than it is right now, and that could all change.
And it never will be. We have to leave the conversation there. Thank you so much for joining us again, Doctor.
Thank you.
Appreciate you.
Thank
All
you
right.
very much.